Good evening, colleagues. Thank you for this opportunity to speak with you tonight. My name is Paul Cary. I'm a nurse. I'm an associate professor in the Duke University School of Nursing, and I am the Equity Scholar for Duke AI Health. And my mission is clear, and that is to eliminate biased algorithms and then retool healthcare's future. Because I believe everyone deserves ethical and equitable care. Over the last 7 years, my focus has been on eliminating bias in healthcare. Particularly the kinds of bias that arise through the use of complex, sophisticated computer algorithms. These algorithms and the larger world of artificial intelligence, or AI, are extremely hot topics right now. Just a few weeks ago, 60 Minutes aired a special focused on their new AI chatbot and its capabilities. And over the last several months, you cannot read a national paper without seeing something new about ChatGPT and its applications. So, what does this mean in the context of healthcare? And what does it mean, or what happens if the data that these algorithms are built with contain fundamental errors that impact patient care? Well, the answer to that question is that it impacts certain patient groups negatively. Let me give you two examples. In my first example, consider a pulse oximeter, a ubiquitous device that uses a light sensor to measure oxygenation in the blood. But research shows us that the pulse oximeter can produce inaccurate readings in people with darker skin tones, as well as people that use certain types of nail polishes, leading to disparities in care. Another example involving 2 million patients, where a biased algorithm systematically excluded Black patients from accessing needed care management services. And when that algorithm was corrected, the percentage of Black patients who could then access needed care increased significantly from 17% to 46%. So it's alarming to hear about the potential disparities that arise through the use of biased algorithms. And so we clearly have more work to do if we want to ensure that every patient receives ethical and equitable care. But to do that, we need health professionals with diverse perspectives. If we're going to challenge or if we're going to tackle this challenge of bias and discrimination in healthcare algorithms. I grew up in rural Virginia. And as a Black man, I've faced my share of discrimination many times. And so I know the sting of racism. I also know what it's like to live in a rural, low-income, low-resourced area and have to drive over an hour to access the nearest medical center. As a nurse with more than 15 years of experience in working with older adults and their caregivers in a fragmented system that at times falls short of meeting the health and social needs of patients, I know what that's like. And as one of the few PhD prepared nurses in the country, dually prepared as a health services researcher and an applied data scientist. My unique perspective and professional training as a nurse scientist has positioned me at Duke to lead initiatives that focus on the evaluation of clinical algorithms and their impact on patients. I'm so proud of the work that we do at Duke. Most recently, I led a 10-member team of nurses, physicians, statisticians, and engineers. Look at that group. Don't they look happy? Right? Together, we produced the largest, most comprehensive report of bias mitigation strategies in healthcare to date. And thank you. So that work is mission critical in order to provide ethical and equitable care to our patients. But that's just the beginning. This is a call to action, colleagues. We have an opportunity to improve the care to so many patients at Duke, across the state, and around the world. And with your continued support, we'll be able to expand our thinking and our reach, because everyone deserves ethical and equitable care. Thank you.